Hi, I'm Dr. Almisha Campbell. This is Innovate Exchange, and we are coming to you live from the University of Kentucky in Lexington. Welcome to another edition of Innovate Exchange. I am your host, Almisha Campbell. Today with me is Dr. Deshana Collett. Deshana, welcome.
Thank you. Thank you for having me here today.
Talk to us a little bit about your role and your research here at the University of Kentucky.
Okay, so I have been here about 16 years. I'm actually an alum, so undergrad, graduate, and my PhD from here. But I've been a professor here since 2008. I'm a professor in College of Health Sciences, physician assistant program. And I primarily teach in clinical methods course and our patient management course. I haven't been teaching the last 2 years because I've actually had an assignment over at the president's office, but for all of those years that I've been in the program and going back to the program, I primarily teach in those clinical and technical skills courses. So as I started in my journey here as a professor, I could tell within my courses and classrooms, there was just something missing, particularly around the area of health disparities and how do I incorporate that into what we're doing and really teaching our students how to provide care to all walks of life that come through the door. And so one of my courses, the clinical methods course, does a lot of hands-on technical sort of skills. And in that course, one of the skills that we do is suturing. And we teach our students how to do different types of suture techniques and wound closure. And for years we used pig's feet. And pig's feet is nice to a point. It's not as realistic, but it's as close as you can get. It's better than using bananas, I would say some people use. And so we use pig feet, but it's only good for a day or so. And so I started thinking about what can we do that would enhance our pedagogical approach in this course and allow students to learn how to suture, but also they could take something with them. They could go home. It's very hard to take a pig's foot home that's been thawed out and keep it for weeks at a time. And so I started delving into trying to make something for them. And it was a fail a couple times in the beginning, but I really I started doing a lot more research on what would work, what would stand up to heat, what would stand up to the test of time, would last a little longer. There are many inventions out for consumers to buy that they can use, like suture pads, and I didn't want one of those that just kind of had sponge-like material or just a layer of skin on top. I really, really wanted something that was very much so realistic. And so I and a partner of mine within the PA program came up with our invention. It's called MediSkin. And so MediSkin is basically a versatile artificial skin, but it's very much realistic-like, and it comes in different skin tones. The skin can be sutured, you can do IND abscess, we can do phlebotomy, and so it's a multi-use sort of tool. And so we incorporate that actually within our teaching in the program. And it's portable, so our students can stick it in their white coats. They can go into their emergency room rotation. When they have a break, they can sit and they can practice their suturing techniques. So it was a pretty big invention for us to do, and something our students have enjoyed and appreciated since we've started doing it.
That's an awesome technique. And why was it important to have different skin tones?
Because our patients aren't one skin tone. And what we see is a lot of task trainers and things that we train our medical students on, is one flesh color. And that's not what you're seeing out in practice. You're also not seeing the same level of skin integrity. And so is it thinner in our elderly patients? Is it thinner? It's a wide range. And so for me, and you'll hear this with, students will say, well, I couldn't do a venipuncture. I couldn't see their vein. Their skin was darker. Okay, so you're going to figure out how to do this. It doesn't matter what their skin tone is. And so that was our way of saying we're going to create these different skin tones because we all come in different skin tones. And they're going to see patients like that. So it just opens them up to a different variety of what they need to be thinking about when they go in. So, you know, everything they see, even dermatology, is really kind of tailored towards a lighter skin tone, and that's not reality.
Right. What was that journey like for you going into the tech transfer office, disclosing your inventions and the process that tech transfer goes through? What was that like to you? And you can give me the good, the bad, the ugly, and however you see that.
I don't think there's really any bad. I started off in the Accelerate USL program that we have here. And so brand new, of course, intimidated because there are so many people who have these amazing inventions. I'm like, oh, I just have this little skin, you know. But they were very welcoming and tied me to a mentor, which was very good for me because I didn't even know the language people were speaking, you know, and really guided us week by week all the way through the process to being able to do our pitch. You know, here is our valuable product here. Here is, you know, what do you want to do? Do you want to do a startup? So really some of the things that I had no knowledge about, it gave me, I won't say a great foundation because I'm still not good at this, right? But a good starter foundation to understand how this actually works. And I've continued to work with the center throughout this time because we're looking at folks that we can partner with. We're looking at whether we want to, you know, lease or do a sub-license, with these folks. And we're just looking at different avenues to kind of take this to the next level.
And so with that journey and what you've learned, have you figured out how to incorporate some of those in your classroom, or with talking to students about how to think about IP as they're going through their program?
I haven't yet because this last 2 years, I'm actually in a different position where I'm not in the classroom as much. I am the Senate Council Chair, so
Congratulations.
Thank you. Well, I'm coming out of that, so it's been 2 years, and it's more of an administrative function, so it takes more than 50% of my time has been allotted through the president's office. So I haven't been able to be in the classroom with them teaching that part as much. But even before then, we had a lot of discussion. So right before I got into this position, I was already in the Innovate, UK Innovate. And so we did have a lot of discussions. I have a student who was going to pursue actually helping to make some things for the skin, a container, and using some 3D techniques and some designs that he had come up with my other partners. So yes, I have talked to some students about it.
Okay, so awesome journey, and I'm glad that you have the resources here at the University of Kentucky to support you. Like you said, you came in brand new and you had to learn this, but you were able to move beyond that and develop your technology. Now students are able to use it, and I think it's also, you know, critical that people understand. You kept using the word language, but you also talked about the different skin tone and understanding that we are all not the same. So that's why we push this inclusive innovation ecosystem approach, where we are saying to people, hey, we need all people of all different colors, all different backgrounds to be engaged in the process. So for you as a Black woman in this space, how has that been for you?
It's been pretty welcoming to me, and it's been eye-opening as well. So when I've talked to other folks, they're like, I didn't even think about that. I didn't think that that would be important. I had a conversation with a lawyer, attorney, just about the licensing and some of those things, and his brother-in-law works with GE, and they do ultrasound, and he says, you know, my brother always has issues when he's teaching the nurses, and you know, they're like, well, we can't see it on darker skin tone, so just give us like the lighter task mask, you know, task trainer basically that they have, and there are not very many darker task trainers that are out there, call them low fidelity task trainers. So he was like, this would be an amazing, you know, idea to put forth in other spaces. And I was like, it does ultrasound well.
Right.
Like we can actually ultrasound the skin. And he was like, have you even talked to them? So it's eye-opening to see these different spaces that this technology can actually be incorporated in, you know, particularly around a teaching training tool.
Awesome. And I think it's good that, you know, that adaptability is there for different sectors and how you can use it. What I want to ask you now is, what strategies do you employ to ensure that teaching methods address healthcare disparities? Because you talked about that as one of your main focus. We know we're in the South. We know what health disparities look like in our communities. So how do you address some of those?
Well, since my courses that I have taught in the past are really lecture labs, it is incorporated all the way through. And I really encourage my students to question the data, to question the science. So if it says more African Americans, get kidney disease, and I say, we'll question that. How did that research come out? How do we know that? Because did they just do a selective, mark what you are on the paper, and that's how they figured out someone was white or Latino or Hispanic? How did they actually figure out? Because there's a lot of those research articles that come out that are really pretty much what you see, phenotype, and not necessarily genotype. And so I always have my students kind of question what they see there. Is this really right, or are we kind of pushing more racialized medicine? So all African Americans should start off with a calcium channel blocker. Why? Why is that? So my genetics may be very different from your genetics, from some other, person that's sitting across from me. And so we shouldn't put people in this bowl and in this square box and say, this is how we treat everyone. It should be, we treat everyone with the quality of care that we're supposed to, no matter what they look like. Is this the best product for them? Is this the best treatment for them? This the best medicine? Not based on, well, all African Americans should start off on a calcium channel blocker. That's the wrong way to look at it. And so I really do incorporate quite a bit of that within my teaching with them.
I like the different methods that you're doing, and it makes me want to ask you, why this profession?
Why this profession? So it's a long journey. I started out thinking I was going to go to med school. That was my journey. I was a young mom, 17-year-old single mom, and putting myself through school and working. And the more I worked in the healthcare field, I actually worked in OBGYN. And the more I saw what the physicians were doing versus what some of the PAs were doing, I really started having more of a love for the actual profession of the physician assistant. For me, it was that they had more time to sit down with the patient, so the compassion that they were able to give to the patient was just amazing to me, and that was what I really wanted to do. It wasn't, I didn't want to worry about the bills and the lights staying on as much as I wanted to be able to do this, but also, what if I don't want to do, for instance, family medicine forever? I'm a generalist, so I can go from family medicine to peds. I can go from peds to orthopedic surgery. And so the variety and flexibility that the profession gave me was amazing. And it was something I was like, this is me, this is what I'm going to do. And I just went straight for it. And after doing that, I worked in family medicine and PM&R, so physical medicine rehab. And then the university sought me back out to come back to the university and teach. And that was at that time that I got my PhD, and I've been here ever since.
Awesome. So what's next for you on your entrepreneurial journey, or even your teaching journey? What's next?
I'm not sure what's next. I have a lot of things in my mind.
Don't say retirement.
Yeah, oh, no, I wish. My husband says absolutely not. So, no, not retirement. I've got some thoughts about really expanding the skin line and what we're doing out to different sectors. So even, tattoo artists, estheticians, so really broadening where we are from outside of the medical realm, medical education realm. And I hope to do that more within the classroom as well. Okay. So that's the next step with this. Career-wise, I have no idea where the good Lord is going to take me, but I listen. And so whatever comes next is where I'll follow.
And you'll be ready for it. I know you have the technology here with you. Would you like to show it to us?
I just bought one sample. And you can see, so that is the skin. And you can see the scaling of the skin. This one I cut, I cut open, so you can see the sub-Q layer of the fat, and this is the actual muscle layer. You can see every layer of the skin if you ultrasound it. But I have about 6 skin tones.
Okay, that goes along with it.
I can put tubes in it, dye, and so it will come up red, blue.
This is awesome, and I think, as you said, looking at the different uses of it, tattoo artists, different people, and having the different skin tones so they can actually see what that would look like, because as they put in different colors in tattoo, you want to make sure it blends really well.
And I've had a tattoo artist tattoo the skin already.
Really?
And yeah, it's amazing.
Oh, congratulations on
Thank
this
you.
journey.
Thank you.
I appreciate you sitting down here with us.
you
Anything
for
you would like
having
to
me.
share with our audience before we leave?
Thank you for having me. The only thing I would really share is, you know, don't let your mind stop you from doing something. You really want to do it, go for it. Go for it, go for your dreams. Don't be fearful of failure, because failure always turns into opportunity.
Yes.
It really does.
Yes.
So, thank you.
I love that. Thank you so much for being here with us. It's a pleasure to meet you, and all the best on your entrepreneurial journey.
Thank you so much. I appreciate it.
Thank you for joining us today for another edition of Innovate Exchange. Thank you.
At Jackson State University, we're not just focused on today. Our students are building tomorrow. The JSU Center for Innovation and Entrepreneurship is redefining education, a vanguard of technological innovation. This is what the future looks like. This is what tomorrow holds. Learn and teach, research, build and grow. Jackson State University. Become who you're meant to be.